Medical coding is a vital part of the healthcare system, converting patient diagnoses, treatments, and medical procedures into standardized alphanumeric codes used for billing, insurance claims, and data management. For freshers entering this field, interviews often test not only theoretical knowledge, but also accuracy, attention to detail, and understanding of coding systems such as ICD-10, CPT, and HCPCS. Employers look for candidates who can maintain precision, confidentiality, and compliance with healthcare regulations. If you are preparing for your first medical coding interview, this guide will help you understand what to expect. This video has some of the most common interview questions for freshers, with detailed sample answers and tips to help you respond confidently and effectively. Understanding the role of a medical coder. A medical coder reviews clinical documents, identifies key information, and assigns standardized codes that represent diagnoses and procedures. These codes are essential for billing insurance companies, maintaining medical records, and ensuring accurate reimbursement. The role requires a mix of medical knowledge, analytical ability, and computer proficiency. For freshers, employers prioritize candidates who understand coding principles, can interpret physician notes correctly, and demonstrate commitment to accuracy and ethical standards in handling sensitive information. Question 1. What do you understand by medical coding? Here's how you can answer. Medical coding is the process of translating healthcare diagnoses, procedures, medical services, and equipment into standardized codes. These codes are derived from medical reports and are used for billing, insurance, and statistical purposes. Accurate coding ensures proper reimbursement and helps maintain a reliable record of healthcare data. Tip: keep your answer clear, basic, and show your understanding of why coding accuracy matters. Question 2. What coding systems are you familiar with? Here's how you can answer. As a fresher, I have studied and practiced using ICD-10 for diagnoses, CPT for procedures, and HCPCS for medical equipment and supplies. I understand how each system serves a specific purpose and how they work together to create a complete medical billing record. Tip: even if you lack work experience, mentioning your training and familiarity with major coding systems shows readiness. Question 3. Why did you choose a career in medical coding? Here's how you can answer. I chose medical coding because it allows me to work in the healthcare field while applying analytical and detail-oriented skills. I enjoy organizing information, ensuring accuracy, and contributing to the efficiency of medical billing and insurance processes. It's a profession that combines my interest in healthcare with my love for structured, precise work. Tip: highlight motivation, attention to detail, and interest in healthcare operations. Question 4. What steps do you take to ensure coding accuracy? Here's how you can answer. I always begin by carefully reviewing clinical documentation and identifying relevant details before assigning codes. I cross-check each code with official coding guidelines and ensure that modifiers are applied correctly. Regularly updating my knowledge through official sources also helps maintain accuracy. Tip: employers appreciate candidates who value precision and continuous learning. Question 5. What is the difference between ICD-10 and CPT code? Here's how you can answer. ICD-10 codes describe diagnoses or conditions, while CPT codes are used to document medical procedures and services. For example, ICD-10 might record a diagnosis like E11.9 for type 2 diabetes mellitus without complications, whereas CPT would code for the treatment or service provided. Tip: keep the explanation short and supported with examples. It shows both clarity and practical understanding. Question 6. How do you handle incomplete or unclear documentation from physicians? Here's how you can answer. If documentation is incomplete or unclear, I would never make assumptions. I would reach out to the physician or authorized medical staff for clarification through a formal query. It's essential to ensure accuracy and compliance rather than risk incorrect coding. Tip: show that you respect compliance and communication protocols. Question 7. How do you stay updated with changes in coding guidelines? Here's how you can answer. I regularly review official coding updates from organizations such as the American Health Information Management Association, AHIMA, and the American Academy of Professional Coders, AAPC. I also participate in webinars and read coding newsletters to stay informed about revisions and new rules. Tip: continuous learning is key. Show commitment to professional development. Question 8. Can you explain the importance of confidentiality in medical coding? Here's how you can answer. Confidentiality is critical in medical coding because coders handle sensitive patient information. Maintaining privacy and following HIPAA regulations ensures patient trust and protects the healthcare provider from legal issues. I understand the importance of safeguarding patient data in every step of the coding process. Tip: stress ethical responsibility and adherence to data protection laws. Question 9. How do you handle pressure or tight deadlines? Here's how you can answer. In medical coding, accuracy and timeliness go hand in hand. I stay organized by prioritizing tasks, double-checking codes, and maintaining focus even under pressure. If needed, I communicate with my supervisor to manage workload efficiently without compromising accuracy. Tip: show composure, responsibility, and time management skills. Question 10. What would you do if you found an error in your coding after submission? Here's how you can answer. If I identify an error after submission, I would immediately report it to the relevant authority or supervisor. I would review the documentation, correct the mistake, and ensure it's updated in the system. Acknowledging and rectifying errors quickly helps maintain credibility and compliance. Tip: honesty and accountability are highly valued traits in medical coding roles. Question 11. What do you know about medical billing and its connection to coding? Here's how you can answer. Medical billing relies on accurate coding for successful claim submission. The codes assigned by coders translate medical records into billable information used by billing departments and insurance companies. Any coding errors can lead to claim denials or payment delays. Tip: show understanding of how coding impacts the entire healthcare reimbursement cycle. Question 12. How would you handle a claim rejection due to incorrect coding? Here's how you can answer. I would first review the rejection reason and trace the specific code causing the issue. Then, I would compare it against documentation and guidelines to find and correct the mistake. After verifying accuracy, I would resubmit the claim with proper justification. Tip: demonstrate problem-solving and accountability. Question 13. What skills do you think are most important for a medical coder? Here's how you can answer. The most important skills for a medical coder are attention to detail, analytical thinking, knowledge of medical terminology, and a strong understanding of coding systems. Time management and confidentiality are also crucial for maintaining productivity and compliance. Tip: relate your personal strengths to these key skills for a stronger impression. Question 14. Describe your familiarity with medical terminology and anatomy. Here's how you can answer. As part of my training, I studied medical terminology and human anatomy to understand the structure and function of body systems. This knowledge helps me interpret physician documentation accurately and select appropriate codes for diagnoses and procedures. Tip: for freshers, emphasize academic preparation and eagerness to apply what you've learned. Question 15. Why should we hire you as a medical coder? Here's how you can answer. You should hire me because I have a strong foundation in medical coding principles, a high attention to detail, and a genuine commitment to accuracy. I may be a fresher, but I'm eager to learn, adapt quickly, and contribute to your organization's success through quality and reliable coding. Tip: end with confidence and enthusiasm, qualities every recruiter values in entry-level candidates. Final thoughts. Medical coding interviews for freshers focus on fundamental knowledge, ethical awareness, and willingness to learn. Employers understand that new coders may not have extensive practical experience, but expect them to demonstrate accuracy, discipline, and professionalism. Before your interview, review common medical terminology, ICD-10 and CPT structures, and HIPAA compliance guidelines. Prepare to discuss real-world coding scenarios and explain your thought process clearly. With preparation, honesty, and enthusiasm, you can show that you are not only qualified, but also passionate about building a career in medical coding, a profession that forms the backbone of efficient healthcare administration.